Risk of driving by patient with ear balance disorder. The risk of driving by ear balance disorder patient depends on the severity of their symptoms and their ability to control their dizziness. If a patient's symptoms are mild and they are able to drive safely, then there is no need to restrict their driving. However, if a patient's symptoms are severe and they are unable to control their dizziness, then they should avoid driving until their symptoms improve. Some of the factors that can increase the risk of driving for ear balance disorder patient include the type of ear balance disorder. Posterior canal ear balance disorder is the most common type and is also the most likely to cause dizziness while driving. The severity of the symptoms. Patients with severe symptoms are more likely to experience dizziness while driving. The patient's ability to control their dizziness. Patients who are unable to control their dizziness are more likely to have an accident while driving. The type of vehicle. Patients who drive large vehicles, such as trucks or buses, are at increased risk of an accident if they experience dizziness while driving. If you are a ear balance disorder patient and you are considering driving, it is important to talk to your doctor about your individual risk. Your doctor can help you decide whether it is safe for you to drive and can provide you with tips on how to drive safely if you do decide to drive. Here are some tips for driving safely with ear balance disorder. Avoid driving when your symptoms are severe. Take breaks often to rest your head. Avoid sudden head movements. Sit in the front seat and avoid leaning over. Keep your eyes on the road and avoid looking at other vehicles or objects that could make you dizzy. If you feel dizzy, pull over to the side of the road and wait until your symptoms improve. It is also important to be aware of the laws in your country regarding driving with dizziness. Some countries have laws that restrict or prohibit driving if you have ear balance disorder.